everybody. Thank you for joining us today on Guide to Feeling Better. I am your host, Sarah White. I'm the director of the Campbell County Drug-Free Alliance, and I thank you so much for joining us today. We are lucky to have in studio Shannon Gilley.
Hello.
And Shannon is a prevention specialist with the North Key Regional Prevention Center. So Shannon, thank you for being here.
Well, thank you for having me, Sarah.
Yes. If you could maybe just give a little background information on what you do at the Regional Prevention Center, and then also the work that the Regional Prevention Center does locally.
Yeah, sure. So we come down through the Department of Behavioral Health at the state. Every region in Kentucky has a Regional Prevention Center, and ours works with the northern 8 counties. So we do Carroll through Pendleton and up. So Campbell County is the county that we're in quite a bit too.
Mm-hmm.
A lot of the work we focus on is working with community drug-free coalitions. So we do a lot of work with the Campbell County Drug-Free Alliance, as you know. And we're really here to help support the community's efforts to reduce substance use. So our aim is not to come in and say, hey, we know better than all of you what your community needs to reduce underage drinking or marijuana use, what have you. Our aim is to really help support the work that the communities already know needs to happen. We're really fortunate in this region that a number of our coalitions across the 8 counties we work with have drug-free communities funding, which comes from the federal level. Really helps them get some money behind a lot of the action plans that they have. So there's a lot of capacity built up around the region to work on substance abuse prevention at the local level. And we're just here to assist.
That's great. And I know you have been such a tremendous help at the at the Campbell County Drug-Free Alliance, serving as the current chair. So thank you so much. So you talked about your role kind of with the working with the coalitions.
Yes.
What type of prevention efforts are you all specifically kind of helping kind of get going through North Key?
Yeah, so there's a few different things. One of the bigger projects that our office is working on right now is a region-wide needs assessment. Needs assessments can be very intensive and take a lot of time, and we know that it's not necessarily something that all coalitions have the capacity to do, especially at a pretty deep level. So we've been able to compile a lot of data from different sources around the region and at the state level to make sure that it's relevant, as well as local data. And that's about a year-long process. We're about halfway through it right now, but we're really excited about, because so many of the coalitions focus very specifically on 1 or 2 substances, we're able to bring a focus to the array of substances that youth might be using. So while methamphetamine might not be a use drug of choice right now, it's still an issue for some people. We're able to help represent the entire array, and we're able to bring that data back to the coalition so that they're able to better plan their initiatives. The other piece that we're working quite a bit on is a separate grant that came from the federal level down to the state, and then it got distributed to the RPCs, the Regional Prevention Centers, and that works a lot on suicide prevention and opiate reduction, especially among the service members, vets, and families in our region. So that's a population that we haven't typically worked a lot with before in the Regional Prevention Center. But since we started working on this grant a few years ago, we've really been able to increase our capacity to work on suicide prevention efforts. And we're also sitting on a local military and veterans coalition, so we've been able to make a lot of contacts through that as well.
And that's a great segue. As many of you may know, this month, September, is Suicide Prevention Month. And so we will kind of dive into the work that you are doing and what the Regional Prevention Center are doing through this grant.
Yep.
So we'll be back. Welcome back to Guide to Feeling Better. I am here with Shannon Gilly. And Shannon, in the previous segment, you had talked about the grant that you have there at North Key at the Regional Prevention Center, and it's specifically focusing on suicide prevention with the military community.
Yeah.
Can you talk more about the work that you all are doing with that grant?
Yeah. So that grant, it has the two pieces to it. So it has the reduction of prescription drug use, misuse rather, and then suicide prevention as well. So we know those two things are intertwined. A lot of the risk factors for using substances, especially prescription drugs, are very similar / the same for risk factors when it comes to suicide. So in the military population, the military is a very specific group to be working with, and obviously we can take general statistics, but that's not really helpful when you're working with a specific subpopulation. So it's very important to us that we have the actual facts about what suicide looks like in the military. Some of those facts include that 22 veterans a day die by suicide, which is a very high rate. So nationally, about 120 people die by suicide every day, and about 1/6 of those people are veterans. Now, we all know that veterans do not make up 1/6 of the population, so their percentage of the suicide deaths is outsized compared to their actual prevalence in the population. Veterans especially are more prone to suicide for a number of reasons, particularly after the first year they get out of the military, and then after the age of 65. So that doesn't necessarily line up with what we see just generally. We know that transitions out of the military can be very emotional, can be very stressful, and a lot of the information that people who are about to leave the military receive about suicide is hard to transmit when you've got this idea of, oh, I'm going back home. It really depends on what's really important to me at this moment. And so while there is some information received about suicide prevention, you've got a lot of other things going on. So it doesn't necessarily hit people where it's most helpful. So we know that firearms caused over 49% of the suicides in 2015, and for veterans, their rate of using a firearm is higher than the general public. So some of that might be that they're more comfortable using firearms and they know how they work. Especially for female veterans, they're much more likely to use a firearm in an act of suicide compared to the general population. So access to different lethal means is a really big issue for military, as well as the impact on children. So when a family member dies by suicide, especially if it's a parent, that really increases the risk of the child. Up to 4 times, they're up to 4 times as likely to die by suicide themselves if they've had a family member die by suicide. So suicide is not an isolated incident by any means. There's lots of ripple effects, and many of us have seen them. But the impact on the family members is especially severe, and we really need to pay attention to how we can help support both people who are suicidal, but also family members, or what we would call survivors of suicide, people who have lost somebody to suicide.
So we know that 49% of suicides were caused by the use of a firearm. Is there anything that you all are doing, or even nationally, to, I don't know, encourage people who are in the military to lock up their firearms, or what type of prevention strategies are you using?
There are some smaller things, like when we're at tabling events or what have you, like we'll often have gun locks out. Those will just work on little handguns, so that's something small, but people really latch onto that because it's something physical they can take. I think a lot of it is the conversation around firearms, and realizing that if you see someone who may be suicidal, and we can talk about what some of those signs might look like, it's okay to say, hey, I know you're having a rough time, like, would you mind if I hold on to your guns for a week, for a couple weeks while you get through this? It's not an infringement on anybody's rights. What it really is trying to make sure that we're able to prevent some tragedies from happening. I think helping people realize that this is about helping each other. It's not about making a stand about one thing or another. It's just really making sure that we're able to help people when they need it, and knowing that it's okay to say, hey, I see you're going through a rough time.
Right.
This might be an issue. Would you mind if I hold on to them? And saying that as a friend to somebody. You don't necessarily, that's not necessarily what you're going to say to someone walking down the street who you don't know.
Right.
But we know the people around us. We know what's normal for them. If something seems off, that's an okay thing to say.
Okay.
So helping people feel comfortable with that.
Yeah. And so when you are at these tabling events, who are they typically sponsored by, and who are you all partnering with locally as far as with the military population?
Yeah, so the Northern Kentucky Military Veterans Coalition is a coalition that was set up by the Tri-State Veterans. It's a community action group up in Cincinnati, but they do a lot of things locally in Northern Kentucky. And so they've been a really great resource for us because they help connect us to different military or veteran providers, as well as a lot of vets themselves. So, for example, they had a Veterans Reflections Night in August, and what that is they brought in a few different veterans, one of whom was the Lieutenant Governor of Kentucky, as well as a lot more local people, and they just were able to talk for 10 to 15 minutes about an experience and what being in the military meant to them. It was a really interesting way. And I think it was about 120 people there, I think, 160 people. About half of that group was military connected, and about half were civilians, I think. So it was a really nice event for people to kind of understand what military culture is a little bit, to have some people from the military speak their stories, which often don't get heard, especially by just the civilian population.
Right.
So the coalition and TVCA have done a lot of work to help kind of bridge that civilian-military divide. And so we set up, for example, a table outside of that. We had a lot of lock boxes that you can use for prescription drugs as well as drug disposal kits. We know that people who use substances are at a high increased risk for suicide. So the connection here is that if we're able to help stop some misuse of prescription drugs, that could potentially prevent some suicides down the line. So we're really trying to go upstream in our suicide prevention efforts.
Okay. This is fantastic information. Thank you so much for sharing this and talking about the military population in regards to suicide. When we come back, we will talk about suicide kind of just in the general population, and look at some like warning signs and different things like that.
Great.
All right. We will be right back after this break.
I didn't want to talk. She just sat with me. That was all I really needed.
We got back. One day he called me out of the blue, and it's comforting to know that I always can count on him to have my back.
She called me from time to time. I really didn't think I needed any help.
It took me from being really depressed to feeling like somebody cared. It gave me some hope. Just that one text.
Be there. Your call, your presence, your words, your support. Be there and help save a life.
Welcome back to Guide to Feeling Better. I'm here with Shannon Gilley, Prevention Specialist from the North Key Regional Prevention Center. And the discussion that we are having today is focusing on suicide. And we are doing so because September is Suicide Prevention Month. So in our previous segment, we had talked about the military population in regards to suicide. What is some information that you can share as far as suicide with the general population, and then also like some warning signs, I guess, that we should all kind of just know?
Yeah. Let's see. So statistics are fun. Well, we know there are definite disparities. It's not an equal risk for all subpopulations. So for example, females are 4 times as likely as males to attempt suicide, but males are twice as likely to actually die from it. A lot of that is contributed to the fact that males tend to use more lethal means. So males tend to use things like firearms more often than females do. Some other breakdowns that we have, there are specific groups that are more likely, like the military that we mentioned, they were at more risk compared to the general population. People who use substances or misuse substances are at an increased risk. People on the LGBTQ spectrum also are at increased risk. Lots of specific subgroups are at a higher risk than the general population. And we kind of see that depending. So we're not able to just say, you know, person X has this percent of risk, because it's always very specific to, or tends to be very specific to a lot of other factors that they might be dealing with.
Okay.
Yeah.
And so what are some of those warning signs, things to look for?
There's a number. So there are a few different kinds. There are verbal cues, there are behavioral, and then there are also situational. So verbal clues, I'm a pretty direct person, and so there are direct ones, and those don't necessarily leave a lot of room for imagination. So that might be someone saying, I'm thinking about killing myself, or I don't want to live anymore. Things like that are pretty clear what that means. Not everyone is necessarily that direct. So some people might say something like, I'm just tired all the time and I don't want to go on. I had a friend once coming, they happened to be in Europe at the time, and we were talking on Facebook, and she said, I just want the plane to land at the bottom of the ocean. Going through the number of trainings I've been through, I was able to say, oh, I know what that is. I'm going to follow up with the situation as it continues. So there are direct, and then there are more indirect ones. All of them require some level of conversation to just try to dig a little bit deeper on, like, hey, what does that mean? Like, how can I help you? And helping get people to some assistance. So behavioral clues might be things like if someone has seemed especially aggressive or angry recently, or if there's someone who's generally pretty outgoing and have become pretty withdrawn, that might be a clue. If someone, for example, is giving away prized possessions, something that you know they love and they're trying to get rid of, that's an example of a behavioral clue. So you're just looking for some anomalies in what you know is standard behavior for somebody. And there's a number that we could go through. And the last group to look at are situational clues. So those are things that often we might call trigger points. Often that's just one kind of really big event that happens, whether that's the death of a loved one, especially if it's by suicide, like we talked about earlier. Loss of a job, being expelled, fear of becoming a burden to others is a really big one. So those are more points in time that you can say this person might be at an increased risk. I think the really great thing about suicide prevention is that it's something everyone has a piece in. So we don't ever need to worry about oh, that's not my job, or oh, I don't know what to do here. We're always able to have a conversation, have an open conversation, and then say, I think we might need to get help. Would you be willing to call this number with me, or go to this clinic, or kind of be there with someone and just have an open space for them to be able to process what they're thinking. So often I think people are worried about bringing up the subject of suicide. There's this misconception that if I ask about suicide, it'll put the idea in their brain. And there have been multiple studies done that say that does not increase anyone's likelihood of suicide. In many cases, it actually releases that pressure that they might have been feeling, because if someone else is able to bring it up, they know it's something they can talk about, which can help get them to the care that they actually need to hopefully get past it. So yeah, there's a number of clues and warning signs, and I could talk all day about them, but that's just a couple of them. And so you had talked about how you are a direct person, so you may feel comfortable asking someone, but for just the general, population, the viewers sitting at home, they may not feel as comfortable. So I have heard of a training, and I believe you all are providing these trainings called QPR. And I've kind of heard it referred to as like the first aid of suicide prevention. So would you be able to kind of explain what that is, what QPR is, and even if someone would be interested at home, how they could perhaps go about getting trained? So QPR is a 2-hour session. It stands for question, persuade, refer. So it's 3 steps. It's not rocket science. I don't think anything in these presentations necessarily surprises anybody. It just helps put suicide prevention into a format that we know we can follow. So the benefit of something like QPR is that it's been studied. It's on the National Registry of Evidence-Based Programs, which means that people have done studies to show that when it's used, it actually does reduce the likelihood of someone dying by suicide. So it's not just someone standing up and talking to you for 2 hours. You know, it's something that can actually be helpful. So yeah, our office runs them. It goes through a lot of the warning signs like what we talked about a little bit ago. It goes in more depth on them. And then it goes through how to ask a question, how to persuade someone to live, basically. And then the very important piece is the referral. So how do you refer someone to help? So we go through a number of different resources that are both local and national. Those include connecting people to the North Key Access Line, for example, and that's a local resource. But it also includes the Crisis Text Line, which is a national text line that helps on suicide prevention, as well as the National Lifeline, the National Suicide Prevention Lifeline, rather. So we really take people through the process of here's what the situation might look like, and go through a number of them. Here's how to handle it, and then here's how to just make sure you connect to that person. So the big disclaimer at the beginning of it is you're not going to leave here as a licensed clinician unless you already are. This is just training for normal people like us to learn how to connect people to help and help break down the stigma a little bit about what suicide really means. Yep, so we offer them. I've done a number of them with just different community groups in the northern 8 counties. So we are happy to come out. They're typically for groups of about 20 to 30 max, but I've run them with as few as 5. So if that's something people are interested in, they can always contact our office or send me an email, and I can get you that contact information. So.
Yeah, perfect. And have you found that the schools are utilizing the QPR training?
Yeah, I have done the QPR training I think I've done about 15 presentations over the last year, and I think at least 2 of them were for school staff. And I think there was another one. So a number of schools have either sent people or specific departments, like a specific set of counselors, have asked for it. And so we know that it's able to help get into the schools a little bit and help address, because schools are faced with so many liabilities and concerns, and obviously you're dealing with the youth. So they've got a lot of vested interest in making sure that they're able to help address suicide effectively. And I think schools, from what I've seen, they want to do it well. There hasn't necessarily been a big push nationwide that this is something everyone is in on, although I think we all care about it. It's just there hasn't been a big national, we all need to get behind us and do this now. So it's been great to see individual schools or individual school districts approach our office about offering the trainings, which are free, and we're able to set up wherever you need them. So.
Okay, that's great. And really, it's just a tool to carry around in your toolbox if and when it would be needed. So that's great. We will be right back after this short break, and we will continue speaking with Shannon Gilly.
Listen, you're my friend.
I noticed you haven't really been yourself recently.
Yeah, I feel like something's up.
How are you?
Are you okay?
Is there anything you want to talk about?
I just want to know how you're feeling.
And listen, even if you don't know what to say, I'm here to talk.
No matter what you're going through,
I just want you to know I'm here.
I've got your back. When you want to talk, I'm here.
Welcome back to Guide to Feeling Better. I'm here with Shannon Gilly. We are discussing the topic of suicide and suicide prevention. September is Suicide Prevention Month. And so, again, thank you for being here. We ended the last segment talking about QPR trainings. and, you know, kind of having that tool for your toolkit if and when needed. Sorry, that was difficult for me to get out. And, you know, and how important that is. Yeah. So can you talk about the resources, other resources outside of the QPR trainings, and also maybe who, on average, like who are being referred to these resources, if there's like a specific population?
Yeah, so that'll tie in really nicely, as we talked about with QPR. That last R is the refer. So what we typically do in a QPR session is when we get to that piece, we talk about local resources and national resources that people can use. And these are resources that if someone sees someone or talks with someone who might be in a suicidal situation, we can't necessarily make that call ourselves, but we know how to get them connected to help. So some local resources that we recommend a lot are the North Key Community Care Access Line. North Key Community Care is the community mental health center for the Northern 8 counties. So they have an access line that is open 24/7. If you're with someone or you're someone who yourself who needs some attention that might be related to suicide, you're able to call that number. There's always a crisis counselor on staff who will be able to meet you, I think typically within no more than 2 to 3 hours from when you call, but it's typically much quicker than that because Northern Kentucky is not that big. So that's a resource that we definitely want people to know about because it's local and pretty quick on response. One of the national resources we talk about quite a bit is geared more towards teenagers and youth, but anyone can use it. It's the crisis text line. Its number is 741-741. I recommend people just save these numbers in their phone. You never know when you're going to need it. It's nice just to have it there. So,
so can you say it one more time?
Yes. So the number is 741-741. You just text it. And what they do, a lot of the texts they get are not about suicide. They're about a range of situations someone might be in, but 30% of the texts they get are about suicide and depression. So they're very well versed. And these are volunteer counselors who are working on the other end of the line to help what they, as they call it, get someone from a hot moment to a cold moment. Help just make sure that they're able to get the help they need. So they have local resources that pop up, and the benefit of doing something via text is that they're able to actually code for the words that come through. So if there's the words, "I want to kill myself" or something like that in a text, they'll bump up to the top of the queue because they're able to say, this is a code situation that we need to make sure we're able to address. So that's the benefit of something like that. Text is really private. Text is really, no one knows you're doing it. And so they talk about, they peak every day at lunchtime at schools because, you know, you've got a student sitting at school and you think she's texting somebody over here and she's actually texting them. So it's just a really nice, discreet resource that especially students are able to use to get help, but anyone would be able to text it and get assistance. So those are two that we talk quite a bit about. There's also of course, the National Suicide Prevention Lifeline. That number is 1-800-273-8255. So that's always one that people can call as well. It's an amazing step to be able to call or get in touch with someone who can help you. A lot of the times we recommend, especially if you're someone helping someone in that situation, stay with them while they make that call, or offer to call with them, or offer to text with them. Make sure that you're just able to be a presence that's able to help get them to the care they need. So those are what we focus on quite a bit, especially at the end of the QPR trainings.
Yeah, that's great. And so just to kind of touch on who is at the highest risk.
Sure.
I know you had talked about just with the text line teens, but is there a very specific group of people?
Yeah, we talk about teens and suicide quite a bit. I think those are suicides that probably get the most media attention. But youth, teens, are not actually the most at-risk populations. So it's actually males, middle-aged males, typically between like 40 and 65, who are most likely to die by suicide. And that's not a group that people necessarily think a lot about. So it's just important that people understand that everyone at any age might be at risk, and that it's something to pay attention to. If you know that your uncle has been having something going on, or they're not at risk. There could be a situation. So.
Right. Yep. Perfect. Thank you so much. And we will continue this conversation when we come back from the break.
Nothing hurts my mom, but she showed anyway. We were trained to help others, but there's strength in finding help for yourself too. We're in this together. Even the toughest of us might not know where to go to get a little support.
The VA Women Veterans Call Center connects veterans with personalized information on VA services that can make a difference. Call 1-855-VA-WOMEN or visit www.womenshealth.va.gov.
And we're back with Shannon Gilly here on Guide to Feeling Better. And Shannon, I did want to ask you, I've heard and I've read that there's been a shift in some of the language in regards to suicide. Can you touch on that?
In language, a lot of times people say commit suicide. I mean, that's something we've all grown up hearing. That's how people talk about it. The word commit, when we have people think about what are we actually saying here, a lot of times it brings up, people think of jail. They think of committing a crime. They think of something someone has done intentionally to cause damage. And there's been a shift recently in that we want to be very intentional about how we talk about it. We recognize that suicide, someone isn't dying by suicide because they want to inflict pain on other people. They're having a very serious mental illness in many cases, and a very big problem, and it's not because they want to strain anybody else. It's just because the level and the magnitude of that problem for them is so great. So we've started shifting a lot more to saying die by suicide because we want to reflect that it's not a crime someone's committing. We're not judging them for the situation. What we want to do is make the space and the language a little bit more conducive to having conversations that can help alleviate that pressure. So that's what we see with the language piece of it.
Okay, so the died by suicide or completed suicide.
Sometimes you hear completed. I've even heard some criticism of that when we say complete, what does that mean? Well, it means we like finished a task or something. So, there's not necessarily a right or wrong way to do it. I think it's just that the communities are having more conversations about how we talk about something, because we all know that the way we talk about something can impact how we deal with it. So.
Right. And so words really do matter. And just being, kind of aware of the words that you are using.
Yeah.
Great. And so just kind of as a wrap up, you have shared so much information and all of it is so valuable. But what are some important takeaways that you want the viewers to remember and to carry with them after this show is over?
Sure. Well, we mentioned it a little bit earlier, but we definitely want people to know that asking someone if they're thinking about suicide is not going to be the reason someone dies by suicide. Making sure people are very clear that it's okay to ask the question and it's okay to use the word. I think really helps relieve a lot of pressure for some people, because I think a lot of us have sometimes wondered it and been scared. So that's a very important piece that I want to make sure people realize. Another piece of it is, even we can all be the best suicide preventionists in the world. Like that could be our jobs all day long, every day. We're still going to lose people to suicide. It is not a reflection on us or on an individual that, oh, I messed up and now they're not here. That it speaks again to that level of pain they're going through. It is not a reflection on us not being able to do enough. So especially in QPR trainings, I really make sure people recognize that it's not a reflection on you. We could do everything perfectly. We might still lose people, and we don't want that to be a block for some of us who are trying to work on the issue. And the last point that I really want to make, specifically to people who might be suicidal right now, or have been through a suicidal situation in the past, please reach out. Please talk to somebody about it. I think people are afraid to talk about it, and we're trying to reduce that stigma. But I'm always surprised by how open people are to the conversations when I have them. People want to help. People want to be there. Sometimes they don't know how to do it. It's not necessarily fair to anybody, including the person who's suicidal. Sometimes we need people to help us. While we try to get to that place together, please reach out to somebody, please. Call the National Suicide Prevention Lifeline, text the crisis text line, call North Key, call 911. Please talk to somebody.
Yes. And can you give the number for the text line again, and for the National Suicide
The National Suicide Lifeline, so that's the number you call, is 1-800-273-8255. The crisis text line, so that's just texting, is 741-741.
Great. Thank you so much for being here today, for sharing all of the information. If you or someone that you know needs help, please, like Shannon said, do not hesitate to reach out for that help. So thank you so much for being here.
Thank you for having me. Thank you.